Hi everyone, I'm Dr. Scott Theirl here today with 2 minutes on TMJ dysfunction. Now your temporomandibular joint is the joint that connects your skull to your lower jaw, your mandible. It lives just in front of your ear on both sides, and it's a beautifully complex joint that you use all day long while you're talking and while you're chewing. So it's a very important joint to make sure that it works well. If you're having difficulty with your TMJ joint and its surrounding musculature, you may notice that you have pain while you're eating all the time, or also just generalized headaches and face pain. So face pain in that area, headaches that tend to be more temporal in nature, all tend to come from TMJ dysfunction. And that dysfunction is oftentimes biomechanic, which means muscle and joint dysfunction. So what are we going to do about it, right? Well, we want to make sure that from a muscle perspective, the muscles that live on the side of your skull that actually come down and insert onto your jaw are nice and loose, and we don't have any trigger points in those areas. We also have muscles that are underneath the skull, inside of the jaw, that help you stabilize your jaw from side to side. And we want to make sure that those muscles have nice full range of motion and don't have actual dysfunction or trigger points in them. The joint itself has a little cartilaginous disc inside of it. And that particular disc sometimes gets displaced and usually results in a lockjaw type of scenario. So sometimes you'll actually get a picture of that joint to see how that disc looks and how much space is in there. Most people do not have that type of problem though, which is good news. You don't actually want that issue. Now, from a total body pain perspective, neurotransmitters play into how we perceive pain. So a lot of times with chronic pain and chronic TMJ issues, we will look at neurotransmitters to see how well we can fuel your nervous system to help you inhibit pain responses while we're working on the biomechanics of the jaw and the face and the head. And lastly, from a brain-based neurology standpoint, we want to make sure that your head and neck posture are just as beautiful and balanced as could be. And you'll remember that going back to looking at brain-based eye exercise videos and how the cerebellum integrates our spinal posture and our neck posture and our head posture is so very important. Because as we end up having an anterior neck carriage, we end up changing the way that the muscles that actually move our joint, our TMJ, push and pull on the joint itself and on the lower jaw. So we usually have to do a lot of work with the neck, with the eyes in terms of neuro rehab, and then get that cerebellum really healthy, loosen the muscles that surround the TMJ, and make sure the joint itself is looking stellar. That's my 2 minutes on TMJ, or temporal mandibular joint dysfunction. I hope that was helpful and insightful. Thanks so much for tuning in. Have a great day.